today I'd like to talk about a very common topic in pregnancy, which is fetal abnormality or fetal anomaly. Fetal abnormality or anomaly are conditions that arise whether during pregnancy or after pregnancy. They cause some form of abnormality in the baby. They are not normal and may lead to some form of deficiencies, defects. Now generally, fetal abnormality has two types. One that is chromosomal, the others that are non-chromosomal. Chromosomal means they are genetic factors, which means they arise from problems with the chromosome. And then non-chromosomals are usually due to maybe environmental factors, uterine factors, ovarian factors, nutritioncy of the mother, of the fetus, and then maybe also an infection, these types of factors that are actually well in our control. So to make it clear, right, in between these two factors, the most treatable one is the non-chromosomal one, because we simply need to diagnose what is actually causing this abnormality, fix it, and then in your next pregnancy, you will actually have a full-term successful pregnancy. But as for chromosomal one, as for now, we still don't really know what to do because especially those that are lethal mutations, lethal genetic mutations or deformity-causing genetic mutations. It's not a form of treatment that we can actually give our patients that can assure that their next pregnancy will not result in the same outcome. And so generally, fetal abnormality leads to two types of abnormality. First of all is a structural abnormality, and secondly is a functional abnormality. Structural abnormality simply means that there are some defects in the organs, in the fingers, cleft lip, abnormally large head, these types of things. And then functional abnormality is something that is not so well detected or identified because there are defects of the nervous system, the digestive system, mostly internally, which is usually arises after pregnancy. And they can lead to different outcomes. For example, they can lead to fatal outcomes during pregnancy, where the pregnancy ends in a spontaneous abortion because of the lethal mutations or some other factor causing it to terminate itself. And then the other outcome is that the pregnancy is born, the child is born, but they will end up developing diseases, or it comes up with some defects, some intellectual disabilities, problems regarding its growth, psychomotors. So these children, they will have a much more different life compared to normal children. So during your prenatal checkup, you will have a diagnosis session where we will take a sample of your blood and also do an ultrasound to actually identify any potential fetal abnormality. Now, fetal abnormality, although they can be identifiable, but they are not always identifiable. Some are even non-detectable. You can only see them after the baby is born. So we cannot guarantee that we can detect this abnormality. But to increase your chances, we will want you to do this ultrasound and also this blood test in your second trimester as well. In your third trimester also we want to do it just to make sure and increase our chances. But some are still undetectable upon during the entire pregnancy, and also we still need to wait until when the baby is born. Now, a lot of times when these babies have severe disabilities, severe chromosomal abnormalities, our recommendation to our patients is that it is best to terminate this type of pregnancy because the baby most likely will not survive for very long after the baby is born, maybe 1 to 2 years depending on severity, and also they will bring a lot of stress and pressure for the parents. But ultimately this is actually up to the parents themselves. We don't really decide for them. We can only offer our guidance, and our experience. But this is also a very difficult choice, and especially for those who are facing genetic abnormality, when they experience pregnancy loss after pregnancy loss, and when they come to us for help, we don't really know what to tell them because, as I mentioned, chromosomal abnormality, fetal abnormality, is actually an unsolved problem. We still do not know what exactly triggers this genetic mutation, and sometimes they are actually carriers of these mutations, whereas these genetic mutations happen inevitably. So what we can do is actually just maximize the chances of a successful pregnancy and control what we can control, which is the non-chromosomal type. We will need you to do a full systemic checkup. Here at Antai Hospital, we will need to do a diagnosis of your blood, your internal hormone balance, your ovaries, uterus, the quality of your endometrium, your diet, your environment that you're living. All of these are some things that we can control, and we can maximize the chances of a successful pregnancy. Antai Hospital has years of experience in the treatment of pregnancy diseases and also miscarriage prevention. If you'd like to find out more information about topics such as fetal abnormality, please visit our website and also leave me a comment down below.